Hi, my name is Brooke Swindle. This is going to be my sterile wet to dry dressing change for nursing 113 at Bevel State Community College. So I'm at the nurse's station, and the first thing I'm going to do is check my physician's orders. So I'm looking at my physician's orders, and I see he has ordered a sterile wet to dry dressing change for my patient. So I'm going to go enter my patient's room and check on them and make sure they understand what's going to happen. I'm going to knock. They're going to tell me to come in, and I'm going to hand hygiene as I walk in. I'm going to say, hi, my name is Brooke Swindle. I'm a Bevel State nursing student. I'm going to be assisting your RN today. Can I see your armband and you tell me your name and date of birth, please? They're going to verify their name and date of birth. And I'm going to say, your physician has ordered a sterile wet to dry dressing change. Do you know what that, have you had one before? They're going to say, no, they've not had one before. I'm going to say, okay, I'll explain it to you. It's very simple. I'm going to take off your old dressing, and then I'm going to clean your wound or incision site with some wet gauze. It's going to be wet with normal saline. I'm going to, after I clean it, it will be wet and cool, but after I clean it, I'm going to take a culture for the lab, because your physician has ordered a culture. Then I'm going to put some wet gauze on it, then some dry gauze, and then a combine pad, and then I'll be done with your dressing change. Do you have any questions about the procedure? They're going to say no. I'm going to say, are you in any pain at the moment? They're going to say no. But if they did have pain, I would give them their pain medication, and I would wait 30 to 60 minutes before I change their dressing. I'm also going to ask them if they have any allergies. They're going to say, no, I don't. I'm going to ask them, do you need anything at the moment? They're going to say no. So I'm going to leave the room and go gather my supplies, and I'll be back in a minute. They say, okay. So I'll leave the room. I've gathered my supplies now, and I'm ready to re-enter the patient's room. I would have hand hygiened as I left the patient's room as well. So I'm going to knock. I'm going to hand hygiene as I enter. I'm going to say, hi, I'm back to do your sterile dressing change that we talked about. Can I see your armband, please? And can you tell me your name and date of birth? They're going to verify that their name and date of birth is correct and they are who they say they are. And then I'm also going to ask them again, do you have any pain? They're going to say, no, I still don't have any. I'm also going to double check that they don't have an allergy. Do you have an allergy? They're going to say no. I'm going to say, okay, well, you can just relax while I prepare my supplies. So the first thing I'm going to do is I would have cleaned the table and the edges. It would be all clean because this is a sterile procedure. So I'm going to get my drape out. And I'm going to get the edge, step away from the table, grab the edge, and let it just unfold naturally. I throw this away. And then I'm going to grab another edge, and I'm going to put, without touching me, shiny side down. Now that I have that on the table, I'm going to get my first pack of gauze. I'm going to open it away from the field. Open it. I'm going to dump it onto the field and throw this away. And then I'm going to get my combine pad. I'm going to open it and drop it onto the field and throw this away. The last thing that's going to go onto my field, sterile field, is the applicator which I'll get the sample with. So I'm going to open it and drop it onto the field. And I'm dropping everything within that 1 to 2 inch parameter so that it's still sterile. Now I'm going to take my next set of gauze. I'm going to open them the same way, but I'm going to set them outside the sterile field because they're going to be my wet gauze. So now I've also got my paper tape and my sterile gloves for later. So now I'm going to take my normal saline. I'm going to check that it says normal saline. And then I'm going to check the expiration date. It is in date. So I'm going to, over my biohazard bag, I would open it, I would put my hand over the tag that says all the information. I would pour a little bit out, and I would lip it as I pour it. So now that I've lipped it, I'm going to pour some on my gauze that's not in the sterile field, and I'm done with my normal saline. Now that I've got my field set up and prepared, I'm going to hand hygiene. I would raise the patient's bed. And now I'm going to apply my normal gloves. I never turn my back to my sterile field. And I'm coughing away from the sterile field because I don't want to contaminate any of it. Now that I've got my gloves on, I'm going to make sure the patient's ready. I'm going to say, I need to expose you now so I can get to your wound, your site. And they're going to say that is fine. So I'm going to peel back their cover and expose their dressing. Now that I can see their dressing, I'm ready to remove it. I'm going to peel up the sides. I'm going to gently peel up the sides. And it's very easy to peel up. I'm being very gentle and I'm not touching the wound. Now that I've got it all peeled up, I'm going to flip it towards me so I can see it. I'm going to look at it. I'm going to look for color. I'm going to see if it's got an odor, how much, how well the patient tolerated it. And I'm going to dispose of that. And I'm also going to look at the wound site for RETA, redness, edema, ecchymosis, which is bruising, any drainage, and approximation. And so now that I've done all that, I'm not touching myself. I'm going to remove my gloves, pinching. And I'm going to hand hygiene. Now that I'm ready to clean the wound, I'm going to be using my sterile gloves. And if my patient was combative or moving around a bunch, I would not sit my sterile gloves on the bed. But my patient's not moving around at all, and so it's okay. So I'm going to open them. And I can touch this packaging. I would throw this away. I'm going to open it. Get under these little flaps without touching the inside. Pull them taut. And I'm going to glove my dominant hand first. So I'm going to pinch the glove, pick it up, and I'm going to scoop my hand in. Now I'm going to scoop under the cuff of the second glove, not touching the inside. Thumb away. Scoop this hand in. And now I can fix my gloves if need be. Now I'm ready to clean the dressing. So I'm going to take one of my wet gauze. I'm going to fold. I'm only going to pick up one, and I'm only touching the corners. And I make a little wonton, and I'm not going to touch this area. First one is going to go straight down the middle of the wound. I'm going to throw it away. And I'm going to pick up a second one, doing the same thing, making my little wonton without touching the center, the bottom that will touch the patient. I'm going to go around to get the other side and wipe down. I'm going to repeat this one more time, and I'm going to clean this side closest. I'm going to throw that one away because it touched the side of the container. I'm going to pick up one. Make sure I just get one pad, only touching the edges. And I'm going to go down the side closest to me. And now I've cleaned the wound. Now I'm going to get the culture. So I'm going to pick up my swab, and I can touch this stuff on this field because my hands are sterile and the field is sterile. I'm going to take the cotton swab applicator. I'm going to just go straight down the middle, one swipe. Then I would put it in my container, and I would put my initials, date, and time, and send it off to the lab. But I don't have a container, so I'm going to sit right here so I don't lose it at the moment. Now that I've done that, I'm going to apply some wet dressings. I'm going to pick up one and drop it. I'm going to pick up a second one and drop it on there as well. Now I'm going to use my dry dressings, which I dumped onto my sterile field. I'm going to pick up one and drop it on there. Pick up a second one and drop it on there. Now I'm going to use my combine pad. I'm going to pick up the edge, and I know the blue line goes up, so I'm going to put that over there. And now I've got the dressing, and now I need to tape it. Excuse me. So now I'm going to use the window pane taping method. I'm going to take a piece of tape and I'm going to approximate it by the side. I'm going to tear it. And I'm going to tape it. I'm going to take another piece. Again, approximating. I'm not going to press on the wound. And I'm going to repeat this for all 4 sides of the dressing. One more piece. Now that I've got the dressing taped, I would take one more piece of tape. And on this piece I would take my pen. I would write my initials, the date and time I did the dressing change. And I would stick this off to the side. I would not put it on the wound. I would not write on the combine pad, and I would not write on, put the tape on and then write on it. That would hurt the patient. Now that I've got the dressing change done, I would clean up all my supplies and throw them away in the appropriate receptacles. I would put my biohazard bag where it needs to go, and I'm going to remove my sterile gloves now. I'm going to remove them like regular gloves, and I'm going to put them in my biohazard bag, and I'm going to hand hygiene. And now that I've finished the dressing change, I'm going to cover my patient back up, and I'm going to make sure they're okay. I'm going to ask them, are you okay? Are you in any pain now that I've changed the side? Or are you good? They're saying, I'm not in any pain. I'm okay. I'm going to say, great. If you have any pain at your side or you need me for any reason, just call. And then I'm going to make sure to lower their bed back into a safe, low position. Side rolls up ×2. Call light and reach. I'm going to make sure they don't need anything. They don't need anything. So I've cleaned up all my supplies. I'm going to hand hygiene. And I would go document now because my patient doesn't need anything. Now I'm going to read you my documentation. 6/16/2020 Sterile wet to dry dressing change. Patient reported no pain when dressing was removed from the abdomen and it was removed with no difficulty. No drainage noted on gauze. I looked at gauze for color, odor, amount, consistency, and how patient tolerated it. Looked at wound for redness, edema, ecchymosis, which is bruising, drainage, and approximation. There are 6 stitches that are intact. If I measured it, I would document the length, width, and depth of the wound. I used normal saline. It was used to wet gauze. It was in date. Applied wet gauze, then dry gauze, then a combine pad taped with window pane tape method. Culture taken from wound. Instructed patient to call if pain increases. Patient left in safe, comfortable position with bed in lowest position. Side rolls up ×2. Call light in reach. Signed, Brooks Wendell, student nurse, and my credentials. Thank you.